It's important to remember that everyone's experience with scleroderma is unique, and you should talk with your own doctor about your specific diagnosis and clinical status.
In June 2016, I finished a series of tests, including my first HRCT and PFT, to find answers for a particularly bad bout of Raynaud's phenomenon. My doctor called me when the test results were in. In a soft voice, she asked if my husband and I could come in to see her that week. I asked her, "What did the test show?" And she said, "Your SCL70 came back really high. You have scleroderma." I thought, "Sclero what?"
That's not a surprising reaction to have, Misty. Most patients diagnosed with scleroderma have never heard that word before. And there's no simple answer to what it is. Scleroderma literally means hard skin in Greek, and it can be a complicated disease to understand, but it's worth taking the time to get to know about it. The more you know about it and its effects on your body, the better you will be able to take an active role in monitoring and treatment.
So there are different types of scleroderma depending on where in the body you're affected. So one type is called morphia, and this is when just the skin is involved. But because scleroderma affects the connective tissue, symptoms can occur in any part of the body, including the skin, the joints, the internal organs, which also includes the lungs. When a number of different tissues and organs in the body are affected, we call this systemic sclerosis, or SSC.
The exact causes of scleroderma are still unknown. What is known in scleroderma is the immune system causes the natural healing process to go into overdrive and produce too much collagen. But no one really knows why this happens in some, but not in others.
It was 2005 when I started to notice that my fingers hurt a lot. Around July, my ankles, knees, and elbows were feeling achy and swollen. And by the beginning of October, I could hardly walk. I was moving very slow, limping, and in pain all over. And I had Raynaud's phenomenon. I also started to notice that I was having a hard time catching my breath. Just doing simple, everyday activities like cleaning were causing me to be short of breath.
There are a variety of symptoms that may be associated with scleroderma based on the parts of the body that are involved, and you won't necessarily get all of them. Most people experience one or two symptoms, but they can appear in any order. People often get different combination of symptoms and have different experiences with those symptoms. It's one of the many reasons why it can be hard for doctors to recognize scleroderma symptoms early on. The symptoms can be mild or severe and can change over time. It is important, though, to spot the changes early because the symptoms can predict the course of scleroderma.
Now that we can identify the symptoms, Dr. Adegunsoy, can you tell us about how all of this can affect your respiratory system?
There are also two key ways in which scleroderma might affect your lungs: pulmonary arterial hypertension, or PAH, and lung fibrosis, also known as interstitial lung disease. While PAH is a rare complication with scleroderma, most patients get some fibrosis and scarring in their lungs, which can be one of the most serious complications of scleroderma. In lung fibrosis, the scarring occurs between tiny air sacs of the lungs. Over time, the scar tissue makes it harder for oxygen to enter your body, which results in impaired lung function. And it becomes hard to breathe. Low oxygen levels and the stiff scar tissue itself can cause you to feel short of breath, particularly when walking and exercising. Kisa and Misty, what is your lung fibrosis experience?
My rheumatologist told me that scleroderma can progress very fast. And based on my tests and scans, including a CT scan, MRI, and bronchoscopy, it had already started scarring my lungs. I was surprised to see how common this is for people with scleroderma.
For me, in July 2016, a month after my initial diagnosis, all my test results were in. The images showed I had pulmonary fibrosis, ground glass opacities, and a 30% loss in lung capacity. The light bulbs started going off. the frequent bouts of pneumonia and bronchitis. How long had I had this?
While most people with scleroderma get some fibrosis and scarring in their lungs, not all develop severe symptoms. For instance, some people with lung fibrosis have very mild symptoms that are only noticed when they really exert themselves, while for others, they may have severe shortness of breath that affects their ability to perform everyday activities.
Because lung fibrosis can develop rapidly and have serious consequences, your healthcare team should perform a number of tests periodically to check your lung function and determine whether you need treatment, and if so, what is the best treatment for you.
So Dr. Volkman, how important is collaboration between a rheumatologist and a pulmonologist when it comes to scleroderma patient care? And how can patients like Kisa and Misty take an active role?
So collaboration with all specialists is extremely important because scleroderma is so complex and affects so many organs in different ways and at different times. So to ensure we can provide the best care, it's important that all specialists are reviewing the regular monitoring and testing that takes place on an ongoing basis.
I agree. I get HRCTs once a year and PFTs and echoes every 6 months to monitor my disease progression. My doctors, especially my rheumatologists and pulmonologists, look at what the tests show, but they also say, let's talk about how you feel. I think that's truly important. They always have seen the bigger picture and monitored me.
Speaking of doctors, I've got a long list of them, a team that I've put together over time. I need my doctors to listen. My rheumatologist doesn't just look at a chart, but he looks at me as a person. He's my go-to. He's always a phone call away. He's also a phone call away from all of my other doctors, including my ophthalmologist, pulmonologist, and cardiologist. I see all of these doctors every January for routine monitoring, and they send the results to my rheumatologist. I'm thankful that they all work together. No two scleroderma patients are exactly alike, so individualized yet collaborative care is important.
Connecting with others is so powerful. One year, I decided to go to a scleroderma conference. Going there was one of the best things I could have done. Seeing others with scleroderma doing well gave me hope that I would have a future. Talking to the different people and feeling the overwhelming support of everyone who had been in my shoes before helped me put one foot in front of the other and really start moving forward.
It wasn't until 2007, 2 years since the day that I realized something was wrong, that everything changed. I was sitting in an infusion chair on my birthday when a nurse came up to me crying and said, "Bless your heart, baby. This is a horrible way to spend your birthday. I'm so sorry." And I responded, "Don't feel sorry for me. I'm celebrating. I'm still here." And in that moment, I decided, I'm not gonna feel sorry for myself anymore. I'm gonna fight this because you know what? I am still here. I'm going to live the best life I possibly can for as long as I possibly can. And part of that meant learning to accept help. I used to be very private. I never asked for help, but I couldn't be prideful when it got to the point where I couldn't even open a bottle of water and I was too fatigued to step foot into a grocery store. I had to start reaching out for help from anybody, family, friends, doctors, even strangers. You have to put yourself first when it comes to your health and well-being.
Don't watch and wait. If you have scleroderma associated with interstitial lung disease and it is left undiagnosed and unmanaged, progression leads to worsening symptoms and deteriorating health. Use the personalized doctor discussion guide and pulmonologist locator on lungsandyou.com. Sign up on www.lungsandyou.com/signup to learn more and stay informed. Call Lungs and You to speak with a dedicated nurse who can help you understand what you're going through. Call 1-844-473-2638 Monday through Friday, 9 a.m. to 6 p.m. Eastern Time.